Let's continue the talk about COVID-19 vaccines. Of course, a success story in Canada. Who remembers how it was in January and February in this country, where it was very hard to find a vaccine and we were waiting? But the situation clearly has changed. Supply is there. Just over 60% of Canadians fully vaccinated against COVID-19. I think we're at 66 or 67% in Quebec. So the numbers here, quite good. But of course, the same cannot be said for many countries around the world. Unicef and the government of Canada are partnering up to do something about it. And with more on this, it's our pleasure to welcome David Morley onto the program, President and CEO of Unicef Canada. David, thank you so much for coming on the show. Thanks very much, Elias. Give us the situation here. We know things are good right now in Canada, vaccination. Supply is there. People are getting the shots. But paint us the picture in the rest of the world.
Well, it's very different in the lower income countries of the world, particularly in sub-Saharan Africa. You know, here you were talking about the great numbers we've managed to do in Canada, but in Africa, it's only about 1% of the population that has had their first dose.
Wow.
So if we know, right? This virus knows no boundaries, no borders, so that we're not all safe until everybody's safe. And so that's why UNICEF has been asked by the world community to lead the efforts to get those vaccines, turn the little vials of vaccines that we always see on TV, turn them into vaccinations. Get the syringes, get the safety boxes, get the PPE that the frontline health workers will need. And our goal is by the beginning of next year to have, in 90 lower income countries, to have vaccinated the frontline health workers and social service workers so that things can start to continue for the people who need it the most, the poor people in these marginalized areas.
We're with the President and CEO of UNICEF Canada, David Morley. We're talking about vaccine access in the rest of the world. So David, what's the solution here? Is this literally a money problem, or is there a supply issue? What's the issue?
Well, a few months ago it was supply, right? Like as we had those supply problems in Canada. Now it's getting into a money problem because, think of the logistics that we've had to deal with here in Canada. And then imagine if you're in a lower income country where there's not a lot of strength to the health services. How do we ensure that you keep the vaccines cold? How can you make sure that they get out to the rural health clinics? And the reason that UNICEF was asked it was because in a normal year, if we can remember what a normal year is, we procure vaccines for almost half of the world's children. All those basic vaccines that all kids in Canada get. We're already doing that. So we have the supply chain. We know the ministries of health. We know the frontline workers. So that's why we've been tasked to do that. And that's why we're really happy that the government of Canada has announced this matching grant program as well, because it'll help us reach more people.
What is that matching grant program?
Well, it's called GiveAVax, and for every dollar that Canadians give to UNICEF Canada for our work on COVID, the government will match it. They'll put in another $1 so that the donations will go twice as far. We're hoping that this program of so a chance when those of us who are feeling grateful that we've got both our doses, both our vaccines, can give to the rest of the world. And we're hoping that we'll be able to reach about 4 million of the frontline health workers through this program and through the matching grant of GiveAVax.
Must be interesting for the team there at UNICEF. Of course, your focus has always been children, right? And this vaccine right now is not available for children, right? It's 12 and over only, right? So, but your expertise there is the key. Is that you've been the largest vaccine buyer in the world for so long? Your organization UNICEF knows vaccines. You know this inside and out.
Absolutely. We've got the world's biggest supply center. It's in Denmark, and from there we're always sending out billions. About 2 billion vaccines a year go out from there to the poorer parts of the world. So we have the expertise, as you say. we're usually vaccinating children. This time we're not vaccinating children. But the impact, think of what the impact of the pandemic was on our children here at home. And it's just been that and worse for children around the world. No school, no health services. So we have to end this pandemic to make things better for kids.
We're with the president and CEO of Unicef Canada, David Morley. David, are you frustrated, though, when you hear stories from across this country of provinces where they've wasted vaccines? You hear it from us, and there's stories from a lot of the Western world. In the U.S., you hear these stories. How frustrating is that? You need vaccines. You want to give it to countries that aren't as economically advanced as ours, and we're wasting them.
It's really frustrating, and we know that this vaccine hesitancy is something that we have to talk with people, help them understand that the vaccines are safe, that vaccines save lives, and that there are people in other parts of the world who are clamoring to get these vaccines so that they can help their economies get back better, get their societies better. So yes, it is frustrating, Elias. It is.
What do you have a message for the Canadian governments and governments around the world that have been wasting vaccines?
Yesterday, I was pleased that there are some extra vaccines in. I think it's in Ontario, but I know that the federal government is able to ship those down to Trinidad and Tobago, who needed them. So we're at least in that case seeing that there's going to be some of that excess is going to help people around the world. But for everybody, just what our health officials are saying, we need to be sure that everybody gets doubly vaccinated against the pandemic. That's going to stop it for us. And once you've had that second one, think of people around the world after that second dose and give a vax, and the government will double it, and we'll be able to help more people around the world.
One last question for you, David, and that is when we talk about developing nations, is it actually easier in those nations to get people to trust vaccines because they've seen the impact of vaccines in recent memory?
That's why people are clamoring for it. They have seen that the childhood vaccines that we've been delivering have saved the lives of children who, for parents, can remember when their older kids might have died, whereas the younger kids have been safe because of those vaccines. So that's why there's such a demand, and why we're asking people to help us meet that demand by making a donation to UNICEF.
Let's hope they get access to vaccines before they get access to Instagram misinformation. David Morley, I want to thank you for coming on to the program. Fastest way for our listeners to be part of Give a Vax, they should go where?
To unicef.ca, and it's right there. When you do unicef.ca, you'll see how you can make the gift.
Keep up the good fight, David. Thank you so much.
Thanks very much, Elias.
David Morley, President and CEO of UNICEF Canada.